So daily chores and daily walkthroughs are the most important thing an animal care worker can do. You know, we're addressing all the 3 points, all the 4 points that we had talked about earlier. One would be feed, water, environment, and then individual animal health. So putting those all together, we're doing that on an individual pen, individual pig basis. So as I'm walking through, you know, I want to make sure I take my time and individually identify any pigs that look abnormal or that look sick. You know, what we can see here is we've got a Gant pig, the blue pig right over there. You know, we can see that he's a little bit redder in color, that he hasn't been eating and drinking as much as he should, and he probably has a fever. So this pig we've already identified and treated, and then we're going to be placing him into a fallback pen with less pigs in it and a lower stress environment so he can recover through both medication and through a lower stress environment. The things that I'm looking for on the pig end when I'm walking through this barn is I'm looking for pigs that are breathing heavily. We call it thumping. Heavy breathing in and out of the rib cage. The other thing that I'm looking for is red butts or diarrhea scours. Usually that's associated with a thin pig as well. So, but we really want to cover 3 bases. Number 1 is respiratory, number 2 is enteric, which would be diarrhea, and number 3 would be we want to make sure that our pigs are full-bellied and eating well, eating and drinking well. So as we're walking through here, you know, we've really identified one pig that needs to be pulled. We do a good job of that, put them in a low-stress environment, and then we can take care of them individually that way. So, you know, and we want to also make sure that we take our time. This is a learned skill. Identifying sick animals is absolutely a learned skill, and we want to make sure that we give every pig the individual time that it deserves.